All right, we're ready to go into chiropractic technique. Now, it may not be a ton of points, but take a look at it. It's 5 different stations out of 20. So we can't discount it. We've got to be good at it. 2 of them will be cervical setups, thoracic setups 2, lumbar 2, the pelvis 2, and extremities 2. So remember, we call them setups for a reason. We're not going to be adjusting. We're not going to thrust. So we're going to work through this very carefully on page 70. But remember, they are 5 of the 25 stations. And you will have 90 seconds in the hall to prepare for each one. So you still get your 90 seconds and then 5 minutes in a room. 90 seconds, 5 minutes in a room. So you have plenty of time to do these. All right, now if you want to put a love note here that, refer to page 2 and take a look at that. 5 stations, 5 minutes per station, of course 90 seconds in between, as all other stations. They can't change these, of course, because, somebody's at this station while somebody's at another. Now, 2 setups per station. This reminds you of the types. Now, scan the patient when you enter the room. Let's just talk about this. When we enter the room, kind of look at the patient, where they're seated. Are they big? Are they little? Is this going to be easy, hard? Is it side posture? Kind of get an idea and if this face paper just looks filthy, dirty, offer to change it. If it looks like it's just been freshly done, then, it's not a big deal. But offer to change the face paper. Wash your hands, because they don't know, where you've been, what you've touched. So give your barcodes to the examiner, wash your hands, and then let's go over there and see if they need their glasses or shoes or socks off. Observe where the examiner is. And the reason we say that is because for side posture and some of these setups, you shouldn't be, the examiner is you in the right there, and I'm doing my move like this. They're not gonna make the setup work that way. So if on side posture, you should be looking like this and not like this. Okay, so in other words, you're probably on the wrong side if your butt's to the examiner. You get the idea? Okay, so you hip to my grip? All right, so that's what I want you to observe where the examiner is, and that's probably going to have some impact on what the setups are anyway. Verbal suggestion is, I'm going to be very gentle. These people have had setup after setup after setup after setup, and you know what it's like early in chiropractic college, how we're practicing our setups and somebody's taking you to tension and you waiting 30 minutes for the examiner to get to you to say whether or not your line of drive is right. And so these people are in a lot of pain, so we want you to take them to tension and then back off a little bit so that you're not hurting anybody. So just let them know, I'm going to be real gentle with you. I'll help you up, help you down, whatever it is that you need. Let's be reassuring. Help position the patient on the table properly. Remember, the patient is dyslexic. Okay, that's what I want you to just assume. Okay, so if you're dyslexic and they're dyslexic, okay, then somebody's got to be in charge, and it's you. Okay, so it's got to be you. So if you ask them to lay on their right side or the left side and they don't, it's not their fault. It's your fault. So we're going to give you some clues and some ways to protect you from you being wrong, okay? So we'll talk about that on the next side, on the next page, but you can read this if you want, but we'll talk carefully through how to do side postures, how to do prone moves, supine moves, so that you don't get your rights and lefts messed up. Don't be a magnet. Just don't go, okay, I'm on C2, okay? Or, okay, I'm on the PSIS. Palpate. Act like you're finding it. Motion. Even if it's the lunate, move that wrist around a little bit and find that lunate. Act like you care. So don't be a magnet. Act like you're counting. Now, you don't have to do any of this out loud. Maybe some of your technique classes, you say, okay, now I am doing a traction pull. Now I am counting down. Now I'm going across from the inferior scapula. Don't say any of that stuff. Okay, the only thing they want to hear from you is line of drive. Do not hold the patient to tension. That's Dr. Laura's reminder. Slightly back off. Once you feel you're in position correctly, freeze. Now, why we say to do that is once you feel like you found it, kind of back off a little bit so you're not hurting them, and then freeze and say your line of drive. My line of drive is P to A, I to S, and then relax. Now, I count it to 5. Right? Remember our all-purpose 5? So that gives the examiner kind of look up, look at your line of drive, see approximately where you are, check mark all the things so that you can get all your points. Some of you do this. You get them there and you go, my line of drive, P to A, I to S, and nobody knows, so it's a big guess. Okay, so maybe you get the points, maybe you don't. I like to be sure I got these points because that allows you to miss an orthoneuro or 2. These are easy points to get, but they're really easy to lose. So I'm going to say that again. They're easy points to get, but they're really easy to lose. So I'm trying to help you get all the points in this room you possibly can. So if you'll just freeze and hold that for a few seconds, that allows the examiner to just give you all those points. Gobble, gobble, gobble them up, okay? Now, the next thing that you want to be mindful of is that when you're saying your line of drive, we're going to lock it out in 2 positions. And we'll talk a little bit about how to do that because we're going to practice many of these, okay? So you got to get a doll, a partner, or something and buckle up because we're going to be doing a lot of that. Now, help the patient up, give them their glasses back or invite them to put their shoes and socks back on. So, get them back to normal because you're going to have like 2 minutes in that room where you're sitting there kind of doing nothing. So it's appropriate to do that. You can use landmarks, so you don't have to start at the EOP to count all the way down to T6. You can just go ahead and use the vertebral prominence. You can use the inferior angle of the scapula. You can use the iliac crest. You can use the landmarks that you're comfortable with, and then count up or down to the segments. They're not looking for you to be neurotic and counting up from L5 or down from C2. Now, when we talk about common contact points, they might ask you to use your index finger. They might ask you to use a digit. They might say do a digit pull. They might say do a digit pull that's reinforced. They might say digits reinforcing. So you've got to be very careful to read what they've said. They might say use your thumb or your piezoform. Okay, or your hypothenar can be your piezoform. Your thenar would be the base of your thumb. Unilateral, bimanual, or bilateral. Bimanual is often connected to the word grasp, bimanual grasp. So that's 2 hands grasping. Double thumb, okay, one on top of the other is traditionally how we do double thumb. Thenar digit. Now that one's kind of bizarre because thenar digit means we're using this part and this part of your hand. That's usually reserved for the anterior moves, okay, anterior thoracics. So thenar digit, and we'll kind of apply that at the right place in our practice quizzes, okay? The thumb index means that we're doing this. Now you can do a thumb index pinch, kind of this, or you can do a thumb index hole, like a donut hole, and we'll talk about that option. That's usually used for olecranon. Okay, then we've got reinforced, like I said, reinforced, with digit or digits, interlaced, okay, to interlace your fingers, the palmar, just meaning your palm, to distract, to grasp, to use the web contact is to do this, with this part of your hand, the web, and then of course knife edge. So I think all of these you should be comfortable with. When we go down here and talk about the common segmental contact points, we've got the glabella. That's kind of a common one on this ridge all the way across. Right in the center would be the glabella, but you can have one over the right or left if you're so inclined to do that. We've got the spinous. Now, the spinous process is AKA spinous process. Everybody catch on to that? There is no AKA for spinous process. But when somebody says TP, that's body. Mammillary, that's body. Lamina, that's body. Lamped, that's body. So body has lots of AKAs. So you have to be on the body side if they say lamped contact, lamina contact, pedicle contact, arch contact, body contact, TP contact. But if they say spinous, you have to be on the spinous side. Okay? So spinous is spinous. I think we all know the PSISs and mammillaries, and okay, so the rest of this I think you should be okay.